Today, we are more and more dealing with much more complex challenges, including mutagenic impurities, nitrosamines, extractables, leachables, and degradation products.
Hello and welcome. I'm Dasani, your host, and today I'm here with Nussbaum. In this session, we'll be exploring key aspects of impurities, nitrosamine, and method validation, along with practical insights from his industry experience. Ralph, it's a pleasure to have you here with us today.
Thank you so much for the introduction. My name is Ralph Nussbaum, and I'm chemist by education, and I'm also a qualified person since several years now. I've been working in the pharmaceutical industry for over 30 years, always in the quality area, and it's a pleasure to be here. Thank you so much for the introduction.
Perfect. So to start off, let's talk about what draws experts into this field and why it matters so much.
Yeah, throughout my whole career as a qualified person and also in QC, I've always been particularly interested in the interface between analytical science and patient safety. And impurities are exactly at that intersection. So they are often invisible risks that require strong scientific understanding, regulatory awareness, and practical decision making. Over the time, I became increasingly involved in impurity investigations, method validations, method development, risk assessment, and I realized how critical these topics are for ensuring the product quality and ultimately, of course, the patient safety.
And this importance has really evolved over time?
Absolutely. The importance has increased significantly. In the past, impurity control was often focused mainly on known process-related impurities. Today, we are more and more dealing with much more complex challenges, including mutagenic impurities, nitrosamines, extractables, leachables, and degradation products. Regulatory expectations have also become much stricter, as you all know, probably requiring more science-based risk assessment, more robust analytical strategy. And as a result, impurity control has evolved from a purely analytical task to a cross-functional and strategic quality topic.
That naturally brings us to one of the biggest challenges in this space, unknown impurities.
Yes, exactly. Yeah, one of the biggest challenges is often pressure in time combined with limited information. When an unknown impurity appears, companies must quickly assess the potential risk of these unknown impurities, identify the root cause, where do they come from, define appropriate control strategies. And all this requires close collaboration between analytical experts, process experts, quality assurance, and regulatory teams. Another challenge is selecting the right analytical techniques and ensuring that methods are sensitive and specific enough to properly characterize the impurity.
And a key area of focus in recent years has been nitrosamines, as I assume.
Yes, absolutely. This is a still ongoing topic in the pharmaceutical industry. Nitrosamines are particularly challenging because they often occur at very low levels, so requiring highly sensitive analytical methods. And in addition, they can originate from many different sources, as we know. For example, raw materials, manufacturing processes, packaging materials, or even storage conditions play a role here. This makes root cause investigations very complex and sometimes unpredictable. Furthermore, regulatory expectations for nitrosamines are very strict, which increases the pressure to develop robust risk assessments and control strategies.
And are there still some common misconceptions around them?
A common misconception is that nitrosamine risk assessment is purely an analytical task. In reality, it requires more comprehensive understanding of the manufacturing process, raw materials, potential reaction pathway. Another misconception is that once no nitrosamines are detected, the risk is eliminated. In fact, continuous monitoring and periodic reassessment are often necessary, especially when changes occur in the process or supply chain.
And from an organizational perspective, where do companies tend to struggle the most?
Yeah, that's the good question. Organizations often struggle most with the initial risk assessment and defining a structured investigation strategy. It sometimes is difficult to identify all potential sources and reaction mechanisms. And additionally, selecting appropriate analytical methods and ensuring sufficient sensitivity can also be very challenging. And last but not least, translating the scientific findings into regulatory compliant documentation is another area where many companies really need support.
Perfect. So let's talk about practical approaches.
Yes, of course. So first of all, it's important to assess the potential risk quickly and define a structured investigation plan. This usually includes confirming the result, evaluating trends, and applying orthogonal analytical techniques where appropriate. In parallel, reviewing the manufacturing process is quite important. Raw materials and storage conditions can also help to identify potential root causes. A systematic and cross-functional approach is really key to efficiently resolve such situations.
And collaborations clearly play a major role in here?
Absolutely. Cross-functional collaboration is essential. Impurity investigation typically requires expertise from analytical development, manufacturing, quality assurance, regulatory affairs, and sometimes also suppliers. Without effective communication between those functions, investigations can become slow and very inefficient. So, yes, strong collaboration significantly increases the likelihood of identifying the root cause and also implementing a sustainable control strategy.
And of course, method validation is a critical part of this.
Yes, absolutely it is. Method validation is really key and critical to ensure that impurities are reliable, can be detected reliable and quantified also. Without properly validated methods, there is always uncertainty about the results. So particularly for low-level impurities such as nitrosamines, sensitivity, specificity, and robustness are key parameters. A well-validated method provides confidence in the data and supports sound regulatory decision-making.
Can you please share some real-world examples that highlight these challenges?
There are many. In one case, a previously unknown impurity appeared during a stability study at very low levels. The challenge was that the impurity was not consistently observed and appeared to be influenced by multiple factors. A combination of analytical investigations, process review, and stability evaluation was required to identify the root cause here. These example highlights how complex impurity investigations can be and at least how important a structured and scientific approach is to get this root cause.
And this is also connected to how organizations approach impurity controls overall, I think.
Yes, a robust impurity strategy is proactive and science-based always. It includes thorough risk assessments, strong process understanding, appropriate analytical controls. A reactive strategy, on the other hand, focuses mainly on responding to issues once they occur. Proactive strategies help to reduce the risk, to avoid regulatory challenges, and to ensure consistent product quality.
Looking ahead of the masterclass, what can participants expect to gain from this session?
Participants can expect a practical guidance, and this is quite important to focus on that, on impurity identification, nitrosamine risk assessment, and method validation. The masterclass focuses on real-world examples, experience from my own life, practical decision-making, regulatory inspections, and the goal is to provide participants with tools that they can directly apply in their daily work.
And who do you think would benefit the most out of this?
The masterclass is particularly relevant for professionals working in quality assurance, quality control, analytical development, and regulatory affairs. It's especially valuable for those involved in impurity investigations, risk assessment, and method validation.
What makes this masterclass stand out more?
The masterclass is strongly practice-oriented and based on real industry experience, also from my experience. And rather than focusing only on theory, it emphasizes practical case studies, typical challenges, and decision-making strategies. Participants gain insights that go beyond regulatory guidance and reflect real-world situations.
And before we close, let's touch on what's coming next in this space.
Emerging risks include complex degradation pathways, new synthetic routes, and increasingly sensitive analytical detection capabilities. As analytical technologies improve, we are identifying impurities at lower levels, which creates new challenges for risk assessment and control strategies.
And from a regulatory perspective?
Regulatory expectations will likely continue to evolve toward more science-based and risk-based approaches. Authorities increasingly expect strong process understanding, comprehensive risk assessments, and robust control strategies, particularly for mutagenic impurities and nitrosamines.
And that brings us to the key takeaways. Impurity control is no longer just technical requirements, but a strategic priority that directly impacts product quality and patient safety.
Absolutely. Impurity control is not just an analytical requirement, it is a critical element of patient safety. A proactive, science-based and cross-functional approach is really key and essential to successfully manage impurity risks and to meet regulatory expectations.
Thank you, Ralph, for sharing your insight, and thank you to our viewers for joining us. We look forward to having you with us in the upcoming masterclass, and I'll see you there, Ralph.
Thank you very much, Tatsumi.